Business Officer with Krishna Diagnostic. Thank you.
Hello, good afternoon, everyone. First of all, thank you so much for inviting me as a part of this panel. I genuinely feel privileged and honored to be a part of this eminent pool of panelists. In terms of, who I am, so it's been now 8 years since I've joined in the business. I'm a second generation entrepreneur. And telling more about what Dr. Bilal Lab is, we're a lab which started in Jaipur in the year 1991. And it's been now 33 years. We've completed 33 years of our inception. And we now are present in 12 labs, 12 cities, and now have more than 140 collection centers. So looking forward to a great interaction. Thank you.
Hi, Gaurav this side. First of all, thank you, VOH, for bringing this amazing forum together. It is a privilege to sit in front of the illuminaries of the healthcare industry and share my thoughts and listen to everything that they had to say. It's a learning experience for me as an entrepreneur in the healthcare domain. As a person, I'm an engineer by education. Actually, I'm an engineer in the healthcare domain, so that itself is a place where it requires a significant amount of learning to come in my way, and these are forums which are helping me in my journey. Otherwise, Haystack is my third company. We are, as a company, focused on bringing genomics to diagnostic labs. We believe genomics, molecular technology, and genome sequencing is going to be the future of healthcare in a very, very big way. And we envision a world 5 years from now where practically every diagnostic lab who is running RT-PCR today would be doing genome sequencing on their table. We build that technology which will enable you. Currently, our focus has been on infectious. We have built technologies for tuberculosis diagnostics using whole genome sequencing, where we provide 18 drug susceptibility, and now a product for infection screening, where we do pan-bacterial, pan-fungal infection screenings using a single test. It's our own proprietary technology that we have created. We think it's a technology which we have created in India for the world. That's our ambition. Look forward to the conversation today. Thank you.
Thank you. I'm Dr. Barnali Das, and thank you, VOH, for giving me this opportunity with this esteemed panel and esteemed people around. And I am lead consultant of laboratory medicine in Kokilabend Dhirubhai Ambani Hospital and Medical Research Institute. Along with that, I'm chair of Association of Diagnostic and Laboratory Medicine, ADLM, previously known as Association of American Association of Clinical Chemistry, AACC, and I am in the executive committee of scientific division of IFCC and different other committees of IFCC. Along with that, I am in different expert panels of ICMR, for example, establishing reference interval in Indian population and different other panels. Thank you. Thank you for giving me this opportunity.
Thank you, panelist. My name is Partho De. What I do is run a startup out of Gurgaon. We try to focus on doing work at point of care, could be at home, could be at office, could be at any other locations, remote places, villages, beyond pathology. So while we are discussing majorly on pathology, I want to also bring the focus of diagnostics towards the non-pathology segment as well. We do X-ray, ECG, pulmonary function test, Holter monitoring, around 7 tests at home, all of clinical quality, and we do provide report within 1 hour. That's a TAT that we promise and maintain. We are able to maintain around 98% time the TAT for the work we are doing for the patients. Patient centricity, if we keep the patient into the center, then definitely all our problems are solved. And I'm sure all of us are doing that, right? This is not a new subject. So when this subject and topic comes for discussion, I always feel that we always do it. Without the patients, we don't exist. But now the question is how we are considering the patients as a customer, as a consumer who is demanding a certain level of services, and how we are going to meet his expectations. So there are two parts of the story. One part is the diagnostic quality of the clinical excellence to ensure that there is a diagnosis that we're doing. Based on that, the treatment outcome will be better. So that's the story, which is a more a clinical part of the story. At the same time, we want to add that what we are doing in the customer servicing aspect of the patients. Patients over here is expecting what they get from any retail. They said that if I'm paying and getting my services from any other service provider, why don't I get same or more where I'm visiting a lab? So that's the expectation, and that's the right expectations. And our discussions would be focusing today mostly to see that what we are going to do for the patients, what kind of transformations that we are running internally in the organizations, what we plan to do, and what kind of a technology that we'll be using to make a patient a satisfied customer. So I would like to start with Dr. Bonali, being the lady on the panel. I think you have the privilege to pick up the first question. Why don't you tell us from your experience, and you are a clinician, so you probably can relate it a little more. I'm sure Rupesh will give a lot of stories from the marketing perspective. So many years he has worked. So if you can just highlight more about the automation, integrations, particularly digitizations, what you are doing to ensure that you have a satisfied customer.
Thank you. So being a lab physician, I believe in the philosophical lines of Albert Einstein. Life is like riding bicycle. To have the balance, we should have the balance to keep it going. So similarly, I believe in our lab life, being a lab physician, or like here we have heterogeneous population, if we see that as a heterogeneous group. So I believe this life or this bicycle ride is our ride in our lab, or either it's a professional ride or personal ride. So there are two wheels of this bicycle. One wheel is the wheel of patient centricity, where we depend mainly on quality, like accuracy, precision, then cutoff, reference interval, or when we talk about omics, different omics. So this is called personalized medicine or precision medicine. So this is the patient centricity. Another wheel is the wheel of cost. So we can't ignore the wheel of cost. Wheel of cost depends on three magic M's: man, machine, and materials. So when we talk about this panel, we will see, I think this covers the all three magic M's: man, machine, and materials. So if we can balance between these two wheels, one is the wheel of quality or patient centricity towards quality patient care or patient safety, and second wheel is the wheel of cost. So I think we can have smooth ride in our lab life or in our healthcare journey. So for example, let me give one example. So during COVID time, COVID pandemic just started, I think February 2020 around. So I was making pancake on Sunday morning for my child. And then I got a call from our intensivist at around 7 a.m. in the morning that Barnali, we want to give one patient who is a clinician in another hospital, big hospital. He came to our hospital, and we want to give the tocilizumab, IL-6 receptor blockage. So we want to give the patient tocilizumab, and for that we want to do the test named interleukin-6. And this is February 2018. Okay, I said, we are not doing the test. Let me find out in Mumbai who are doing the test. So then I called, I circulated in different WhatsApp group, and I called everyone. So in Mumbai, nobody was doing the test. One lab was doing that on Thursday. But I have to save the patient, I have to release the report on Sunday morning. So then I asked, what can I do? Nobody is doing, even in whole India, nobody was doing that time the test, because the workload was very less and people never thought that it will be a good test. We also started sometimes back, but we stopped because there was no workload. But that time, they wanted to give tocilizumab interleukin-6 report. So then, even immediately I got call from my infectious disease specialist that they want the report in 1 hour time, because they have to administer tocilizumab because the patient is deteriorating, and cytokine storm and everything. So even oxygen saturation, so patient is going on ventilator support. So then I called our IVD manufacturers and I asked, can you supply me the kit? So they said, okay, madam, that time lockdown. So no technical support, nothing. So they opened their warehouse and supplied me the kit in 1 hour. And then what about our validation team, our validation procedure, because we have to maintain the quality, patient centricity as it is important. Same thing is important, patient quality, patient safety. I can't, based on the clinician request, I can't say, okay, in half an hour time, I'm releasing the report. I have to validate the new test. So then I called College of American Pathologists, being in their different committees, and that time I was in CLSI committee for validation. And so I called CLSI and CAP and IFCC. Then in pandemic situation, I have to release the report in a 1 hour time. How to do the pandemic validation? So then they suggested to do reproducibility and release the report. So our team arrived in lockdown. We sent for transport. So see, this is the beauty of, if you say, the laboratory journey or diagnostician's journey or clinician's journey. So here, see the stakeholders. Our main point here is patient centricity, patients we want to serve, and see the stakeholders. Diagnosticians, stakeholders, technical staff, stakeholders. Our business administration is the stakeholder because they have to give me permission to start the test in half an hour time. Then IVD played significant role as a stakeholder. Then accreditation body because CAP and NABL, that time how NABL, even Leh Ladakh, by digitization, we supported to open the lab. So this is the beauty of the patient centricity.
Thank you so much for sharing your own personal experience of how you put the patient in the center and get everything worked out, right? Quality has to be maintained, but you found a way to ensure that you are giving a quality report within the defined time. Some point of time, we have to do a balancing act between the two, and you have acted it really nicely over here. Thank you so much for sharing that. Rupesh, if I can come to you and let's have some business discussions. So, as a chief business officer, if you can tell us how big the business that you are managing. We keep hearing about numbers. The numbers are really mind-boggling. So I think today the time has come to kind of unlock some of these. And also, I'd be very interested to know how you guys are still able to kind of manage the quality and customer centricity in a public facility. We all talk about that, doing that in majority of the private facilities, the kind of people who are visiting us. Comparatively, the kind of people that you guys are managing, I understand that they would have majority of the cases, the profile of the people are a little different than typically we see them in majority of the private hospitals. And you have some private patients as well. What is that you are doing to bringing the balance of the doing a huge amount of cases and also ensuring the customer centricity?
How much time I have to answer? 3 minutes. The clock is clicking, so I thought. Well, I'll try to answer within 3 minutes. Yeah. So I think first and foremost, we at Krishna, we understand the geographical diversity. Our effort, actually enhance, right from the urban areas to the heart of the communities where we provide diagnostic services. Strategically located facility is one of the key reason why we are able to do it. This actually, reduces the distance hinder which any citizen of wherever they are part of the country they face. Whereas affordability is concerned, I'll not say affordability, I'll say value of money. This is actually a cornerstone in our mission. Our strategy is such, we always focus on this concern. Our pricing models will always have a fairness in the mind to keep price which is more easily, people can afford. Because the kind of crowd, customer we are addressing. We've also invested a lot in technology, which can bring down the cost. Apart from geography, if you see the cultural diversity or the language barrier, what we do is we operate in 18 states currently. Wherever we go, we hire the local staff. Like for example, we have operation in Himachal, Odisha, Assam. The people who are working with us are the local employees. The one thing by doing that, what we achieve is we take care of the cultural, the respect and understanding and the language barrier. So that really helped us to get that staff in it. The most important thing, I mean, what you mentioned is about the volume. If I give you the number, in last 5 years, we have touched around 40 million lives. We are doing actually 21 million tests per annum. 15 million plus pathology tests we do per annum. And if I say MRI, CT scan, we do around 5,000 scans a day. 15 to 18,000 X-rays a day. That's a huge volume what we handle. So when we have this kind of volume, it helps to give you the bargaining, it helps to give you the bargaining power. So we get the best of the vendor on the board. Like we have Abbott from America. We worked with Horiba from Japan, Diagnostics from German. But we also believe in Atmanirbhar Bharat. So we also worked with new startup. Stick2Pill is one where we are working with that. I mean, that's how we leverage the benefits. So if I see the healthcare diagnostic, I mean, if you see the history, this patient-centered approach started late from 1960s. There were two things which the healthcare industry focused on. One is definitely on the evidence-based practice, and second is the patient-centered, excellence, what we are trying to achieve. Every company, many of the companies have this patient-centered excellence as a part of their mission, vision, or values. So do we also have. But sometimes it's difficult to achieve that number because simply, it's easy to, say, okay, we will go and give the best of patient-centered excellence. The challenges are different. In urban areas, we have a Dr. Google. Now, Dr. Google is one where any patient who walks into a center, he is equipped with so much of information. The expectation of that patient is different level in urban areas. But in rural, the challenges are different. As I said, we are present in government infrastructures, in CHCs, PHCs, medical colleges. So our entire infrastructure is in government setup, where a patient don't have to travel 30 to 40 kilometers, for a scan to be done. He can just go to the nearest, subdivisional hospitals, get the scan done. It is reported through teleradiology hub, what we have in Pune. Just to share with you, our teleradiology hub is India's first NABH aggregated center. That speaks about the quality. We have 300 radiologists working around the clock. So we maintain a TAT of 6 hours for reporting scan. If it is, there are times when there's a critical reports, we do report within 2 hours. So that is the area where we really feel we have achieved accessibility and affordability, both the thing. If I have to really sum up what I want to communicate is, we are really committed to this accessibility and affordability in the diagnostic services. This is actually ingrained in our mission, and we really believe, okay, the healthcare facility is it's a fundamental right. It is not a privilege. So we really want to work in that direction. We are dedicated to break down the barriers, because that's how we will make patient-centered excellence a reality in this country.
Absolutely. Thank you so much. So the kind of scale that you guys are managing is awesome, right? And I really picked up the word that you used, that affordability and the value for money. I have money does not mean that I need to spend. So some point of time we mistakenly think about a consumer behavior, but the consumer always look for value for money, and that's the key for any customer servicing things that we provide. If we think that we'll provide something which will add cost, consumer may not like it. So that's one important aspect. Just taking the cue from here, Sankalp, you were also running labs, and for quite some time you were the second generations of running the same lab. I'm sure you have plans to take it to a completely different notch. I would like to understand from you that, how you guys are ensuring that when you are running multiple of labs in multiple locations, then that similar quality of services, how you are replicating everywhere. If it's comparatively easier if it is being done in one location because you yourself probably being present and can manage things over there. But once it is being done in every different places, what is the trick that you play to ensure that same service is available, same experience is being available? We sometimes call about a McDonald's experience. We have the burger everywhere in the world, it is the same. So what is your formula for that?
Right. So first of all, when you take the word excellence, and especially we as healthcare professionals, for us, excellence has to be the starting point and not the end. That is what the expectation of our customers and of our patients are. And, as a business owner, if I would have to say that, to deliver excellence, what do I expect? I think there are two things. First is right intention to deliver excellence, and second is right expertise. So intention and expertise, if that is there, then you're able to actually deliver excellence on ground. By intention, I mean that genuinely do you desire to give that excellence? And when you're scaling an organization, it has to go from the leader. It has to go from the promoter or the leader. There has to be, when we talk about culture of excellence, then you really have to define by your actions that there is a culture of excellence, and consequences in the organization have to be defined accordingly. So that is one important thing where every person who's associated in the organization, be it a partner, be it an employee, whether they have the right intention. And second is right expertise, where from today's session, I've picked up a lot of buzzwords which are technology, artificial intelligence, but I personally would keep human intelligence much above than artificial intelligence, because as a diagnostic provider, that is what is expected and required. I picked up from Dr. Sushil Shah's session, he termed one important pillar of service delivery as empathy. And what he meant was empathy, is it missing in terms of technology, scalability, all of those things? Empathy is missing, and that is what even we as a service provider feel, that genuinely, that human-to-human connect is missing. In 1991 when we had started, we started with one center, and it was very easy. I'm sure not easy, but I can term it as, it was something that you as a promoter is sitting there and able to manage the quality, the excellence, whatever you desire, you're able to do that. But, when we had started to scale, we were facing some kind of challenges in terms of delivering similar quality in other areas, in other territories. And primarily we focused on three areas. One, people; second, process; and third, technology. And all three in like the order that I had stated. People, I think for an organization and for a service provider, having right people at right place with the right skills is necessary. When I talk about people, it also has to be applied on the partner that you're choosing, because now all the chain labs are operating through partners. And I just think that the people aspect is a little underscored, because a lot of focus is on technology, scalability. But, when you're selecting a partner, I see that even for the national labs, one partner is selected, after 3 months, the partner is being closed. I'm not sure if, the selection process or how much attention is being paid to the people associated with you, and the people, do they have that intention to really deliver? In terms of, I'd also touched upon expertise. And when I talk about expertise, I mean, just from my experience, we had faced those challenges of people not having those similar kind of skills. When we were onboarding people, we were not able to do that properly. One thing that we did was we created a technology platform called eGurukul, which was a learning management system, We created our own content, right from pre-analytic, analytic, post-analytic, all of those things. Ensured every employee that is being associated, every partner that is being associated goes through that mandatory sessions. Through assessments, we're able to really check that they are at a basic level of their skills. And, it really turned out to be some kind of a success for us where we are at least confident that the service on the ground is at least similar to what we aspire to. Second part which I talked about is process, which is again very important and defines how a business should operate and has to be closely aligned with people. Yep. And third being technology, which of course makes these people and process compliant, more efficient, and when we're delivering, it makes it more effective. And then with technology, scalability comes very easily. Just one more example I would want to give is, I'm sure every diagnostic lab faces a lot of pre-analytic errors, and especially demographic errors, basic mistakes that your front office does. What we did was we invented a complete module on our lab information management system, which was called as a way of working, known as WOW module. And every quarter we gave our partners or people some score, and based on the score, whatever mistakes that they were doing, they were automatically triggering on the LIS platform, and they had to justify, what was the reason. If it was not justified, they had a consequence. I mean, there was a reduction in points and all of those things. And based on that, every month, quarter, they had their consequences, be it a reprimand or reward that was associated with that. That really helped us reduce our non-conformities. So, I mean, people, process, technology, all of these things really ensure that we're able to effectively deliver our services as we're doing it in our center of excellence.
Excellent. I think this is basics, but we must follow the basics. Right? The challenge is sometimes we don't follow the basics and we try to do something surrounding the basics. But if the core is not there, anything surrounding the core will not help. So thank you so much for sharing your experience. So Gaurav, can you demystify this genomics for us? So let me ask a consumer question. Okay. So as a consumer, we always feel that this is something outside the reach of people. Only some super senior doctor can prescribe this kind of test, and these tests are only required for diagnosis of very, very high-end, something which would not be required for the general consumer. So I don't know whether everybody would agree with me about the perception of a general consumer about genomics, but when I talked to a couple of guys, I found that's the kind of echoing in their thoughts. So why don't you tell us that what actually it means and how we actually can change the consumer perceptions? That's important.
It's a very loaded question. So I think it's a fair understanding that today the world perceives genomics as a very niche technology. And I think one of the key reasons for this perception is also it is been walled. There have been specific companies who have built capability in this technology, and they have operated this as a niche offering. But I think that's also changing. So we believe there are, again, 3 pillars which will enable as a technology. So for a consumer, technology is irrelevant. Outcome is what matters to the consumer. And for the outcome to reach to the patient, or the consumer, what is important is they are able to afford it, they are able to access it, and they are able to take actionables basis the information that is unlocked to them. What is genomics? Let's take a 101 on genomics very quickly. It's a 2-step process where you first take the DNA, the analyte, you digitize this DNA, and then you go to the next step where you then the data that has been unlocked, you analyze this data and pull up a lot of insights. Genomics has been around us for significant specialties, onco, NIPT, etc., for a long time. Now, what we are seeing is the entire applicability of genomics is increasing significantly because, number one, science, the understanding of the science has increased significantly. But More than that, what has happened is the cost of data creation, which is the sequencing process, has come down a lot. As there are much better equipments which are available, much cheaper equipments which are available, which can actually sit on the diagnostic labs table and do the data creation. And now there are softwares like what Haystack is creating for specific outcomes, which are reducing the cost of the data analysis and hence bringing out the clinical outcome. Now, why is genomics important for the healthcare ecosystem? I think genomics as a science has the capability of unlocking a fantastic amount of information. Why? Because when you're doing a PCR, you're looking at a fragment of the DNA and you're able to unlock the specific question that was asked. When you're looking at the entire DNA, that's what genomics allows us to do, sequence the entire DNA. You are able to unlock a fantastic amount of information. But then, from a patient's point of view, from the doctor's point of view, for that clinical condition point of view, what is important is to understand what is the most relevant, actionable information that you are able to present, right? And that's where I think as a company, as a product creator, we spend a phenomenal amount of our time choosing what should be the right platform, what should be the right protocol, and hence what should be the right outcome information that should be brought out to the doctor so that he's able to take the most action, the right decision in the first go, right? That's the problem to solve. Now, how have we done it? So if you think about acute, infectious is where we have operated for the last 2.5 years of our inception. And in acute, a satisfied patient is the one who has been cured. Then how do you ensure the probability of treatment, the probability of therapy success is the highest? By unlocking the most amount of relevant information. Now, when we took tuberculosis, for an example, we looked at how tuberculosis treatment is currently happening. At the doctor's table, the decision that he has to make is he has to provide 4 antibiotics to the patient for the entire journey of the therapy, which is possibly 6, 9 months, up to 12 months to 18 months. But the information that he has available is very fragmented. He knows about, with one test, a single antibiotic, whether it will work or not, and then 3 antibiotics, whether they work or not, and then 3 more, and then he goes to culture where possibly 13 antibiotics ke bare mein information is available to him. But there are more nuances. What if the patient has a co-infection? Because TB patients show that symptom. What it is if it is a NTM, which can in several times be caught as a tuberculosis in one of the preliminary tests. So we decided then to create a comprehensive solution and use use genomics and then use whole genome sequencing for bringing all of these together in a single report. So now we have a product in the market where once our report has gone to the doctor, he knows everything that is clinically relevant to pick the right combination of antibiotics that has to be given to the patient, which then means, in a way, we have been able to bring personalized therapy for tuberculosis in the limited scope in which we are operating. Now, when we look at infection in general, there are 1,200 plus pathogens. How do you then solve this problem? We have fantastic solutions that are available. Culture has been around. We have been using this technology. We have PCR and now extension of that as multiplex PCR. Several of these technologies are now available. Now, when we started thinking about it, I think the primary question was, can there be a solution where for the patient and for the doctor, the number of iterations that they have to go through, the cascading mechanism of diagnostics that they have to go to, it can be reduced or it can be completely eliminated, right? So that's the primary thought. So the challenge that we left on the team's table was, can we have a universal infectious test? A single test where we will be able to identify everything. I'm not saying that we have already done it, but that's the trajectory in which we are trying to go as a company. And then we realized genomics is the only way it can be achieved again, and hence this is the perfect fit to our capabilities. We then spent the last 3 years, 2.5 years, in building this up, validating it up, and now today we have a product where we are able to screen pan-bacterial, pan-fungal. So the doctor today does not need to think about ये dengue है क्या, या E. coli है क्या, या Acinetobacter baumannii है क्या. He does not need to ask for a pathogen screening. He asks what infection it is. And if in the sample the pathogen is present, we are able to screen, and genomics is a very sensitive technology. It's very well understood. We are able to screen and we are able to provide to the clinician exactly what we have found. Along with that, antibiotic resistance profiles are also available, which then means the iteration is taken away and the doctor is able to focus on the therapy rather than the focusing on the journey of diagnosing the infection or the pathogen that the patient might be troubled with, right? So that's how we are looking at the problem, and we have chosen the problem statements that we would go and solve with genomics basis. Is it going to be the perfect fit as a technology for the scope of the problem that we want to solve?
Thank you so much. So it seems the personalized medicine has just come, right? So we all were thinking that when it will come, so it has come. We have to work with organizations like you to find out the usability more. I'm sure the physician community need to be make aware of what is available. Certain point of time, these challenges also we face. There are a lot of things are being done, but maybe that the way it should have been communicated, that communication has not happened, and that's why there is a certain amount of a consumer education along with all the other things that we are doing probably make it more popular into the market. So before we go to the next sets of questions, I thought after post-lunch session, can I have some questions from the audience? Just to ensure the audience are not sleeping. Is there anyone who would want to ask anything about customer centricity, how in a diagnostics era the customer centricity is playing any role, anything to do with the digitization? Anybody has anything to ask the panelist? So if you are still thinking your questions, okay, so we'll give 7 minutes time. We'll go for the next round, and this time we'll probably all of us would have 1 minute to talk so that we can complete the session on time. I was in Arab Health in last 3 days. There are a lot of things has come up, and every year in any of the new so-called expo or conferences we go, we get to see a lot of new things. So a lot of new technology coming from the startup company and also from the established company that is coming up. And a couple of them are very clearly looking at the patients and making sure the patient is getting a better service. We were all talking about the point of care pathology, we are talking about wearables, etc. The technology is getting matured. It is not matured yet as per my own assessment, but it is getting matured, and hopefully some point of time it will able to at least do a screening level information so that the people are more aware of what is happening with them. So a lot of things are happening on the technology as such. Dr. Das, I thought we'll start with you. If you can share any example of any digitization or anything that at your organization that you guys have done, as in which is impacting the customer. One you have shared with us before. Is there anything else that you want to share with us?
Thank you. So the role of digitization, we realized, I think, during post-COVID era and during the COVID era. So like we are now going for the SDG 2030 agenda, that's the sustainable healthcare. So for sustainable healthcare, we want to decrease our carbon footprint everywhere in our healthcare industry, in our diagnostic industry. How to do that? We need to go for paperless, we need to go for digitization. So for some example, we started like I remember during the COVID time, COVID risk stratification. We realized because of WhatsApp and other like Google and all those things, we realized during the COVID time, even all the patients who have the mild grade fever, having the battery of tests, battery of antibiotics to a battery of medicines. So that time, along with IIT Bombay, we started KCDH IIT Bombay, we started 2 projects. I got the grant for 2 digitization projects. One is on development of electronic health record for acute kidney injury. And second one is the COVID risk stratification. Based on the COVID risk, if we can stratify the test, if we can stratify the medicine. The second one I will little bit, because that's more relevant even current scenario, that's the acute kidney injury, because in the setup like us in Kokilaben hospitals also, because where there is a quaternary, tertiary, more than quaternary care setup, we have seen that around 5 to 20% cases of acute kidney injury, because of the heterogeneous cause of the acute kidney injury, many times it got missed, because what is the relevant, there is no troponins for acute kidney injury, or there is no acute marker. are the markers which are need to be established. So for that, that 0.3 milligram per deciliter rise of creatinine in 48 hours and also in 1.5 time rise in 7 days. So these are the KDIGO criteria, and these are so minuscule. So even the clinicians, physicians, many times they miss the acute kidney injury. So we thought in electronic health record by risk stratify, if we can digitize that. So this is one of the acute kidney injury we are trying, because we thought we can nationalize that plan and we can establish that even at the national setup. Second is like I mentioned about ICMR, we have started that reference interval, task force for reference interval and decision limit. So there are, like when we talk about the reference interval, there are two types of reference interval. We can establish by direct method where we screen thousands of patients and establish the reference, what is the normal range in the population in India, because still we are using the population-based reference interval in American or European reference interval. So this is the direct method which ICMR has started to establish the reference interval. Second is IFCC, we have the global data base based on the indirect method in your hospital LIS or LIS in your lab. We can establish by indirect method the reference interval or cutoff limits. So these are two of our projects, three of our projects where digitization played a very, very significant role, where we have seen the machine learning, deep learning based the clinical decision support or CDS, clinical decision support, play a significant role in our diagnostic ecosystem.
Hey, thank you so much. So nice to know. Particularly, we all will be looking forward for further information coming from you on the kidney part of it. I'm sure once, because most of these projects, it requires a huge amount of data to be successful.
Yes,
so,
when POCT you mentioned, you are based.
Correct.
When POCT is a boon for, if it is used properly, it is a boon. So like troponin I-based POCT devices, if we can CDS or clinical decision support, if we can tag it with the digitization, it can be a boon for the patient.
Absolutely, looking forward. So Gaurav, coming back to you, let's pick up the cost element of genomics. So while you kind of mentioned that, it is an important tool to make sure that there's a personal medicine being practiced by physicians, at what cost?
I think the way the world has been looking at cost of genomics is going to change, and it's already changing. Last 5 years, 5 years ago, ask this forum the cost of genomics, they will say, ho hi nahi sakta, ₹1 lakh per sample lagega. Right? Today we are already talking about exome sequencing happening because data has become cheap. Right? The data creation, the process of data creation has become cheap. So exome sequencing is today available for sub 10,000. I am today sitting here envisaging and possibly taking a bet that exome sequencing will become as costly as RT-PCR is today. And that's the direction of the general healthcare world as a technology, the way we are seeing it evolve. The unlock is going to be at the data analysis level, trying to analyze and being able to make available to the doctor, to the patient at the right time the information that is most relevant. The doctor at any point of time with genomics should not be thinking, कि मुझे test कौन सा करवाना है. And for that, I think this year we will be ending this year possibly not just as a company, but in the country mostly sitting at 5,000 ballpark of exome sequencing rates that would be evident. And in 3 years' time, I think with the number of players who are coming into the market, with the number of platforms that are coming into the market, a data per GB is going to be possibly in like a $0.50 ballpark. That's what we should expect. And a human exome data is ballpark 10 GB of data. So like, do your math.
Okay. So as a consumer, probably some point of time we'll look forward at a 400 rupees genome sequencing some point of time.
हाँ वो भी हो जाएगा.
That's the RT-PCR का equivalent I am looking at, right? If the scale has made a lot of things possible, right? That we have seen, right?
Yeah.
So when RT-PCR started, then RT-PCR was where, and today every company makes money at 400 rupees of RT-PCR. It's not that people are losing money, correct? So all of you are running labs,
I think
so you know
most
that.
of the molecular is actually a problem of scale. RT-PCR, COVID, 4,000 for 400, 300 rupees, right?
Correct.
I think that's the exact journey we have seen. 1 lakh, and now we are sitting at like 6,000 rupees of exome on data. And not difficult to assume why this will go down further, because as consumptions are increasing, the input cost is decreasing. That's macro,
Yep,
right? The input cost of these materials are decreasing. As the applicability is increasing, more competition is coming in. In just this year, we have 2 new players, large players of, again, sequencing companies who have now entered the Indian market, who want to now push their platforms. So I think this is a eventuality. We are living in a fantastic time where possibly we will not only we will see a lot of the concepts of personalized medicine becoming a reality because of, again, accessibility and affordability, all of this meeting the eye.
And yeah, absolutely. I think, we look forward for the days, and everybody should be able to have a personalized medicine being prescribed to them. Okay. Sushankal, very quickly, again, I'm coming back. Though you said that on the rank of people, process, technology, you put technology in the third, right? So, is there anywhere you think that, any specific thing that goes in your mind you want to bring where the digitization or technology is going to make a difference in your customer servicing process?
Right. So, I mean, what I meant to say was, people and process have to be ready for technologies.
Hey, absolutely. We all agree
That's what
towards
I said. And in terms of, technology, and I think for a mid-sized diagnostic service provider like us, what I feel is technology, accessibility to technology is really not a barrier. I think it has democratized, and for our internal and external stakeholders both, we've had multiple interventions. I mean, for a size of organization like ours, we're using Salesforce, and for a size of organization like maybe, which is much larger than ours, is also using the same platform, really shows that the technology has democratized. And yeah, so I mean, in terms of, patient delivery, and in terms of where we are having those technology interventions, I think right from the patient when it looks for our laboratory, to the registration, to the entire patient life cycle, to the engagement of the customer, to manage the customer, the marketing aspect of it. I think all of it is really driven by technology, and in our organization also it's being done through technology only.
Thank you so much. We have 46 seconds, 46, 45. So Rupesh, 42. You have to share what next. You guys have done a lot of things, but I'm sure there is something in your pocket. So what is the next that you are planning? And again, I'll put the digitization and the technology in the forefront. Then what is your plan?
So Dada, I think this is a question I asked to my chairman when I joined Krishna. What's next? Because I came from a background from a private, I worked with all private labs, right? When I entered into an organization which is the 95% business is from government setup. The same thing I asked him. He said that you have to give me answer. What's next? so I think what next, just to, know what time we have, I think ladies on the dais, I know we have to finish it fast. What next is, I don't know how many of you has entered our infrastructure and seen what kind of services we offer in government setup. When a patient walks into a government setup, a government hospital, and when he walks into Krishna infrastructure, he take a step back. He feel कि कोई private है या ये तो कोई मतलब कहाँ गए I mean, it at level is what the private players are offering. So that is the infrastructure we have created within the government setup. Now, how we can leverage this for everybody? Currently, there's only a particular set of population which goes to a government setup. That's a challenge what we have, which we have taken. In last 1 year, we have really taken a lot of steps because entering into private business doesn't mean you open a lab and you create a sales team and then you start marketing and the business will come. It doesn't work that way. For us, what was important, how we capitalize on our existing infrastructure. So the number of patients who walks into our center is huge. So we thought of why don't we start getting private business right from those patients who are already our existing customer. So we started working on our private health checkup packages. You won't believe in last 1 year, we have sold more than 1 lakh packages. I mean, a lot of players must not be selling that in private also. And we have done that. So this is the volume of business we are expecting going forward, which will put us in a different level. Second, we have seen the shift from hospital diagnostic centers to a community centers, to a diagnostic center, to a mobile service, and now to a home care. So home care is going to be a future in diagnostic. So we have understood this strategy, and pan India we are creating a home collection hub. So there are few steps, baby steps we are taking. I'm sure because our numbers are there. We are a listed company. I don't mind sharing number. 66% is our radiology revenue. 33% is our pathology revenue. But we are really looking forward to change the business going forward. Thank you.
Thank you so much. And yeah, there's a question.
Actually, my question is to Mr. Rupesh. Given your volumes and numbers that you're talking about, how are you capturing your customer delight? Because your customer delight is directly related to your top lines.
Exactly.
In the area of operation, I'm sure you must be in the private space along with the government space. How are you capturing your customer delight? Are you using any technology to do it?
So I did mention this in the beginning. We are leveraging a lot of technologies because we understand we are at the level where our major customer focus is on rural areas, on patients who are already coming to a setup where they're expecting everything is free, right? So we are at that level where what they need is a TAT, they need report on time, what they need is the affordable cost. They get delighted by this only, right? So we are trying to focus and deliver that with the help of a lot of technology. And I mean, we see the technology is changing in the diagnostic. I mean, every lab now have cloud computing, right? But now the future, which is the blockchain-like technology, or maybe the virtual reality or quantum computing, nanotechnology, a lot of new things is going to come in the industry. We have developing, we have already, he mentioned about the Salesforce, we are already migrating towards a CRM software where we'll try and address, delight the customer. So there's a lot of steps already taken. I mean, I can't share everything. Otherwise, offline I can share.
Okay, so guys, thank you so much for this insightful discussions. I think over to you, madam. You can start the proceedings.
Thank you, panelists. Thank you for that insightful information and discussion. I'd like to thank Mr. Partha for wonderfully leading the panel, the discussion. I would now request Mr. Partha to felicitate our panelists, and I would request all panelists to step forward for felicitation. Mr. Rupesh Dagar. Mr. Sankalp Gupta. Mr. Gaurav Srivastava. Dr. Barnali Das. Now I'd like to invite Ms. Pinky Cheher to felicitate Mr. Partha. Mr. Partha Deg. I request everyone to please come together for a group picture.